Hello everyone, I am Dr. Nampoothiri, Senior Consultant in Obstetrics and Gynecology at Apollo Hospital, Navi, Mumbai. Today I talk to you about diabetes in pregnancy. We need an optimum blood sugar for the mother during pregnancy because the blood sugar of the baby is heavily dependent on the blood sugar of the mother. If the mother's blood sugar goes high during pregnancy, the baby is also exposed to this high blood sugar and is liable to have many birth defects as well as diabetes in later life. So what is diabetes? Diabetes can be either before pregnancy or it can happen during pregnancy. If it happens before pregnancy, it is called a pregnancy in a pre-existing diabetic person. And if the diabetes happens during pregnancy, we call this as gestation diabetes mellitus. One thing which I want to tell everybody is, if you are planning pregnancy, kindly have your blood sugar checked and correct your diabetes before becoming pregnant. High blood sugar in the first 2 to 3 months causes trouble for the baby as well, causes abnormalities. And even during pregnancy, we do this test called glucose challenge test 2 to 3 times during the pregnancy. Initially and at 28 weeks and at 34 weeks. There is a particular test wherein we ask you to drink 75 grams of glucose and in 2 hours we check your blood sugar. So any value above 140 milligram percent is supposed to be diabetes, and any value between 120 to 140 also you have to be careful. You will have to stop your sweets, stop any kind of sweet and sugars have to be stopped. Certain fruits are to be restricted, and you have to do self blood sugar monitoring at home so that your blood sugar remains under control. And if your blood sugar remains under control and your diabetes medications are taken well, sometimes you may require insulin. And if you do well, then your baby also does well. The next generation is protected from becoming diabetic. India is a diabetic capital of the world, and this is one way in which diabetes is transmitted. When the mother is diabetic during pregnancy, the baby also tends to become diabetic later on in the life. So be very careful with your blood sugar. Thank you so much.